That is the truth, sis. And it's
Not
always I
everybody gets
love.
that luxury.
That's true. That's true. And I love talking to you. One of the things that I enjoyed Minneapolis doing this show is just really being able to help provide information to our community. That's like super number one. But super number two is just being and riding shotgun with Glam Life Kim is just one of the biggest blessings. So to hear your voice, I get activated
Oh,
in the best way.
that's
So
so sweet. And I just got to thank you one more time, y'all. When I tell you, and I appreciate all the calls and love. My niece passed away last weekend, and boy, brother Anthony came through like a soldier. We had a couple days just to pull off the funeral. And boy, when I tell you, I'm so blessed to have you, and I thank you for everything again.
yeah, since you are family, and anything that I could do for you is in the community. I mean, the community loves you too, sis. So
Oh, thank
uh,
you.
you are always in my thoughts all the time. And as well as you are, Minneapolis, welcome to 360. I'm Anthony Taylor from Neighborhood and Community Relations, coming every fourth or second and fourth Wednesday of the month at 1 o'clock. Always my pleasure. I enjoy this tremendously. Today, Minneapolis, I think it's important that we have a discussion about the resources for our seniors and our aging population. A lot of times I think one thing that reminds me when we get around the holidays and being together in family is just being in the space of our elders, our people who hold our history close to the vest, and they share everything about our life, our people, our culture, our history, where we come from. So I always want to make sure that we can have our seniors and our elders up front and in focus. And today we're going to talk about some resources. So if you are around your elders, your seniors, your grandmas, your great grandmas, your aunties, uncles, maybe this show can help give you some resources and some answers to how we can help our seniors. And I love sitting down and talking with our older population because it makes me feel so good inside because they just hold so much dear history of ours. So I want to talk a little bit about that today with two great people. One of them is a colleague of mine that I respect tremendously. As you know, Minneapolis, I'll give them their roses, later on as we start the show. But there's always a little bit of information that I always kind of want to share, and there's a lot of information. So I try to pick and choose some of the best things to talk about. And one of the things is that the booster shots are available, right? So I want to make sure that everybody kind of knows that the choices that we make with the boosters. I'll tell you a quick story, Minneapolis. I got my booster shot on Friday, right? So I got my booster shot. It felt the same as my COVID shot. No symptoms, anything, and I feel blessed to have that. But you can mix and match the boosters. I ended up with my vaccine, Minneapolis. I got the Pfizer, and then for the booster shot, I got the Moderna. And if you've been listening to any information that we've talked about, you can mix and match. The CDC said that that's fine. So I got my booster shots, so they are available. So just kind of want to make sure people, understand that that's possible to get the booster shot. And also there's a rapid testing site in the convention center. So you can get those same results that day. So, look at your symptoms, find out if this kind of affects you, and then you can go and get your rapid testing. And it's at the convention center, so I think that's super important. We know where that's at. It closes on Christmas Eve. The site is closed. So Christmas Eve, Christmas Day, New Year's Eve, and New Year's Day. Testing is free. There's no cost to anyone. So understand that. I think if you want to get a quick test, you can go to the convention center. Also, too, I think one of the things that's pretty important, Minneapolis, is there's a city's basic income pilot program open. Now, this program provides 200 families with an income boost of $500 per month for 2 years, right? So beginning in the spring of 2022, right? So there's 200 families that's selected. You can go to minneapolis.gov GBI to find out what that pilot program applies to. So zip codes are really in our Minneapolis area, right? I won't give you all of those, but if you got a Minneapolis zip code, that's where you're at. So look into that. if that's something that you think that's important, or $500 a month is a great bonus. What I want to tell you to Minneapolis is that just make sure if you apply and you get this money that it doesn't affect other benefits that you may have. So I want to put that out there too. Go to Minneapolis.gov, GBI, right, to figure that out. And I think that's super important. I'll have a person coming on about a public works hiring, right? Lots of great jobs. I have a person coming on from Public Works to talk about some of the job openings that are happening in the city, but and she'll be on, right? So I don't want to give a whole lot of information, but I want to let you know that there's a lot of jobs that are happening in the city of Minneapolis with Public Works. Just to name a few, there's Public Works Service Worker 1, 2, there's Water Distribution Operator 1. There's just a lot of different things. So if you're looking to work inside the city of Minneapolis, I'll have a guest come on to talk about that, because there's a lot going on in Minneapolis, and I always lose my breath because I got a 30-minute show trying to get information on. But with that being said, I want to introduce two people to come on and talk about resources for seniors. One person is Christina Kendrick. People call her Tina, my colleague from Neighborhood and Community Relations, works with our aging population so well. And also Amanda Bigas. And Amanda, if I said your name wrong, I apologize. And she's from Trellis, right? So she's a community outreach specialist. And I want to thank you both for coming on Minneapolis 360. Welcome. How are you guys feeling today?
Well, thank you.
Thanks, Anthony.
It's so nice to be here.
It is great to have you on our show, and I love this conversation, this topic, right? And Tina was the one that kind of mentioned, put this in the space about why not being on the radio. Great idea, right? So what I want to kind of just do is just let people know who you are. So Tina, I speak to you every day. I know everything about you. Let Minneapolis know something about you too. Tell us what you do for our seniors, Tina. How you doing?
Yeah, I'm doing great. Thank you so much, Anthony. I can't thank you enough. I feel so honored and blessed to be here with you talking about what we can do for our older adults throughout the city of Minneapolis. So as you mentioned, I do work with Anthony in Neighborhood and Community Relations. I lead the work for our aging policy and programs within our departments. The big scope of my work is our age-friendly action plan, which was adopted by City Council in 2015. So we're at the end of our 5-year cycle, and we did our evaluation, and it's time to update this plan. So again, so grateful for you, Anthony. Anthony hooked me up at Urban League Family Day. I had colleagues also hook me up other places, and got an opportunity to speak one-on-one with many of our elders throughout the community. And one thing that came across very clear in their voices is our community wants and needs more resources for not only our elders, but their caregivers and other folks in their network. So I've been working with Trellis, which is formerly the Metropolitan Area Aging Agency, that just changed their name to Trellis. And as part of this work, they continue to be an instrumental partner that the city relies on to connect our elders and those who support them with a multitude of resources. So I am so grateful to Amanda and Trellis for spending some time today with us to talk about all their services, and they've actually expanded some that they can offer our elders and our caregivers. So yeah, Amanda, thank you so much.
Yeah, thanks for having me, and thank you both, Tina and Anthony, for having me here today to talk about the important work that is being done to support older adults in our communities. So I appreciate the opportunity today.
Yeah, absolutely, Amanda, and thank you for coming. Just real quick, tell me your last name, spell it, or sound it out for me, because I hate to mispronounce people's names, so
That's
just want to make sure you...
It's Biggest.
Biggest.
Yep.
Got it. Big us. I love that. So, Amanda, I've got some questions for you. Tina, can I circle back and ask you one more quick question?
Absolutely, please.
So with all this work that you do and a tremendous amount of work that you do with our aging community, what's the one theme that you've heard from our elder population and seniors? What's the biggest thing with all your work and all your conversations? What have you heard overwhelmingly?
Well, thank you for that question. The usual response would be, concern about safe and affordable housing and public safety and all that, transportation, access, mobility, all of that does come out. But this last round of engagement, we spoke with over 169 elders, and resoundingly, they're wanting to be connected and wanting their voices heard and wanting to be respected and valued in community was across the board in every community that I spoke with. And so we'll be incorporating some of those action plan recommendations into this next update. As a matter of fact, we're adding 2 priority areas. One is resiliency, and the other is respect.
That is beautiful. And thanks, Tina. I just wanted to make sure I got that out there because I think so much work that you've done. I just really want to recognize the fact that you've been in the streets and you've been talking to a lot of our senior population. So thank you. And Amanda Biggers from Trellis, welcome to the show. Thanks for coming. Tell us a little bit about what you do and about Trellis.
Yeah, well, Trellis is a nonprofit organization. We provide services, information, and connections that help people age well. We do really believe that people deserve to be valued in their community and to age with dignity. Our mission is to assist individuals to age successfully and develop the capacity of communities to care for an aging population. We are the designated area agency on aging for the 7-county metro area. And that means that we work collaboratively with the state through the Minnesota Board on Aging to provide Older Americans Act funds to community organizations that serve seniors. So we work with a lot of organizations within the community to provide funding. And last year, we awarded $14 million to our partner organizations. And we also do partner with the Minnesota Board on Aging to offer senior linkage line services. So Senior Linkage Line is a statewide service of the Minnesota Board on Aging. It's a free information and assistance line that brings resources and assistance to older adults, families, and caregivers. I say that because a question I often get is, how old do you have to be to call the Senior Linkage Line? And the answer is that there is no age requirement. So we do have older adults who call on behalf of themselves. Let's say they're looking for help with Medicare choices. Or we have adult children who are calling to find out about housing options for their aging parent. We have caregivers who call looking for respite and support. And, I know you mentioned, the holiday season coming up. And, this really is a time where, family members might start to notice that older adults in their life may be struggling. Let's say you stop over at their house to drop off gifts or to help put up decorations. You notice that the fridge is empty or their house is dusty because they can't reach the shelves safely. Senior Linkage Line can help find resources like home-delivered meals or tour services. So we do often see a rise in those types of calls around this time. Whatever the need is, we have over 40,000 services in our database. So Senior Linkage Line is there to help. We have specialists available Monday through Friday, 8 a.m. to 4:30 p.m., and we can translate into 140 different languages. I'm just going to give that number for Senior Linkage Line really quick, and I'll give it again before we end today, but it's 800-333-2433.
We are with Amanda Biggers from Trellis Community Outreach Specialist talking about resources for our seniors. And Amanda, just, and you said a lot of services that Trellis provides. And I know there's a lot with knowing the pension and retirement routes. Is there any other services that you might want to share that you may have missed? Because it sounds like Trellis does a bunch of stuff, right, for community.
Gosh, yes. Yes, we offer lots of programs that help optimize well-being as we age. That's what we like to say, optimize well-being as we age. And you mentioned pension and retirement rights. We do have a program that does provide free legal counseling to individuals with pension or retirement plans. And this is not just in Minnesota, but we have 6 states that we do this in. So Minnesota, Wisconsin, Iowa, North Dakota, South Dakota, Nebraska. So we help recover retirement funds. I like to give examples because it's kind of, it's empowering to hear these stories. So I have an example of Isabel, who contacted our Trellis Pension and Retirement Rights Program about a surviving spouse benefit after she was told by her husband's former employer that they had no record of her eligibility. And you can imagine, I mean, during this time, you're grieving the death of your husband, and you're trying to figure out all of this complicated stuff. So our Pension and Retirement Rights Program contacted the plan, filed a claim on her behalf, and was able to get the claim approved. And Isabel received a retroactive lump sum payment of $4,564, and then started receiving an ongoing monthly benefit of $800 for the remainder of her lifetime. So it's a really, really important process that it can be very overwhelming for people. That's just one of the programs. We do also have a program called Juniper, and this program is really working to bridge the gap between healthcare and social care to improve well-being. This is particularly for adults who have high cost and high need health concerns. And with this, we've created a statewide network of providers that offer evidence-based classes to older adults, and we partner with healthcare companies for this. And we're able to offer these either free or low cost. And these are classes that are based on research to help people learn how to manage their health, increase their physical activity, and receive support. Some examples of classes, I'm not going to list them all because we have quite a few classes, but just some examples. We have an aging mastery program, living well with diabetes, living well with chronic conditions, social connect, falls prevention classes, Tai Chi. So a lot of different evidence-based classes. And, as we age, we know that we need good access to healthcare and prescription management and things like that. But we also know that it's really important to have things like social connectedness or learning a new skill. And so these classes are really kind of combining those two things to really create fullness of life as we age. And we've gotten a lot of great feedback about these classes. Somebody who took our Living Well with Chronic Conditions class said, being with others with similar health issues is really good. It makes me feel I'm not alone. So, these are some really great classes for people in our community. And I have one other program I'd like to highlight. We're involved with Statewide Dementia initiatives, and we have 3 statewide initiatives. We have Act on Alzheimer's, which is a statewide collaborative. It equips communities to support people with Alzheimer's disease and other dementias. And we also do Dementia Friends Minnesota. So we hold these information sessions that teach people communication strategies for people with dementia. And we believe that by helping everyone in a community understand what dementia is and how it affects people, each individual can make a difference for people touched by dementia. We know that, dementia is a really complicated and hard disease for the person and for the family, but we know that you can have a good quality of life. So, that kind of helps people understand and be able to provide, dementia-friendly communities. And the last initiative is the Remember Project, and these are one-act plays that are performed by professional actors who bring real issues connected to the care, diagnosis, and experience of dementia to life. So those are some of our main programs that we have with Trellis that really help older adults.
Amanda, that's quite a bit of stuff that Trellis does. Like, I'm sitting here listening to you and getting super impressed at all the work that Trellis is doing. And really one of the things that I love about this conversation is the fact that I can hear your passion through the air, right? So just talk a little bit about why is the work that you're doing so important to you?
Yeah. Well, first of all, I'm happy you can hear the passion. I really do believe in the work that we do at Trellis. And I'll say, too, that, the number of people age 65 and older in Minnesota is growing at a rapid rate. So there's currently almost 900,000 people over the age of 65 who live in Minnesota, and 70% of them are located in the Twin Cities area. And for the first time ever, the number of people aged 65 and older is growing larger than the number of school-age children. So we're seeing this kind of strain of resources in aging services. And one thing with that is that the data indicates that white communities have a broader awareness of available services than non-white communities. And what we're really trying to do is close that gap. We're trying to get the word out about our work, but also being intentional about our outreach to the Black, Hmong, Indigenous, and Native American, Somali, and other African immigrant communities. And something that we did recently is we hired some folks who speak different languages, so Hmong, Spanish, Somali, Swahili, because we do feel that it's important for people that we serve to be representative and see themselves in the work we do. It translates, too, to the materials and resources that we provide. So we did have this really amazing opportunity recently to do a photo shoot of some members of our community. We got some volunteers from organizations that we partner with, because we want them to see their faces on our materials, and this is just kind of in hopes to take one small step in breaking down some of the barriers that may prevent people from either knowing about or using the Senior Linkage Line resources.
We are with Amanda Biggers, Community Outreach Specialist from Trellis, giving a lot of great information. And I'm glad you talked about that too, because I think as we all get older, and especially folks that are probably a lot older than us, right? It's not easy to always navigate these things, right? Yeah. When we're aging, right? And especially in a time for the last almost 2 years, this is not a lot of in-person contact, right? So I think as older populations have to navigate these things, it gets harder because it's out of their comfort zone. And it sounds like Trellis wants folks to know that you're trusted, right? You're a friend and you can really help in this situation. Am I kind of getting the gist of some of that, Amanda?
Yeah, that's exactly it, and we know that in order for communities to trust us, we need to be present in those communities and educate ourselves on how different cultures view aging, because it's not the same in every culture. So, something that we've learned is, for example, Somali elders don't freely share with the younger generation about problems. So when we do outreach, we need to speak directly to the consumer who is the older adult. But you look Absolutely. At the Hmong community, while you do need to get a nod from the elder to move forward, you also need to discuss with the adult child, because, this generation is much more adept at using technology, which, that's the way our world is going, So, for example, booking a appointment for Medicare counseling, or attending a webinar to learn more about healthcare fraud, or even just calling the Senior Linkage Line. And the reason being, a majority of our Hmong elders arrived in the late 70s and 80s, and they don't speak English. So, they seek the approval of their children. So, we need to be talking with the children. So, we're learning as we go forward, and it's exciting and challenging work. But, one thing, too, that we have realized is that, we need to recruit people in these communities to volunteer for us, because they're the ones who are in their community on the ground doing the work, and they know what their community needs. So, we want to recruit volunteers who speak the language, who know the culture, so that their voices can be heard too.
This is amazing information. Like, I don't know, Minneapolis, if you are impressed as I am with Trellis, just off this short conversation with Amanda Biggers from Trellis, I think it's a beautiful thing. And Amanda, just give folks the information, right? How can they get more info? How can they contact Trellis? Is there a website? Kind of let folks know with the little bit of time that we have left.
Yeah, absolutely. So I always, anything related to aging, I always direct you to the Senior Linkage Line. So that number, 800-333-2433, or you can go to our website, which is trellisconnects.org.
And one more time, Amanda.
Yes, so the number for the Senior Linkage Line, 800-333-2433, or our website, trellisconnects.org.
And that is Minneapolis, TRELLIS, Connects, altogether, CONNECTS.org. I'm trying to spell and having a hard time today. But listen, I got it. I got it. Amanda and Tina, I really want to thank you for coming on today. This was some really valuable information. I know that people who are listening that are thinking about, their seniors and their families, hopefully got a lot of good information today. And it's always a pleasure to have good, passionate folks on the call. So thank you for joining Minneapolis 360 today. I really appreciate it.
Yes.
Thank you, Anthony. And I just want to give one little plug. Is a partnership that Minneapolis has with Trellis as part of that. Folks can actually call 311, and they will direct them right to Trellis.
Wonderful.
Thanks, Tina. You guys be warm out there today.
Please.
Yeah, you too.
Please. That was Amanda Biggers and Christina Kendrick talking about our resources for elders. And Kim, I mean, I hold elders are so close to my heart. I mean, they're the gatekeepers of our history. And just if there's something that Trellis can do, I think it's a beautiful thing. And it sounds like they do everything.
It does.
It sounds like they do everything.
There's nothing they can't do. That's my motto.
Yeah, I heard that, right? So, Minneapolis, if you had a chance to get that information, please do. And as we know, there's always not a lot of time left in the show. So I want a big goodbye to everybody. Be warm. Kim, you stay warm too. I know you bundled up already.
Well. I got on my sweater today.
I heard that. One love, Minneapolis.
All right. Thanks, Anthony, for everything.